I'm Dr. Kaveri Shivkumar. I'm a dermatologist. I'm specialized in skin, hair, nail, sexually transmitted diseases, and leprosy, and even your cosmetology procedures. Okay, so to become a dermatologist, you need to complete your MBBS first, okay, which is around 4.5 years, and then you complete your internship, and then give your entrance exam. Clear the entrance exam, score highest marks, because if you have to take derm, it is again radio and derm are the topmost subjects that many people will be seeking out. Okay, so it's basically you don't have any night duties, because a lot of doctors that you see or the people that you see around complain of long working hours. They tell there's no balance between personal and professional life. So dermatology is a field wherein you have no night duties. But definitely you do have some of the dermatological emergencies. Okay, so you have a good work-life balance, you have a time for yourself, you can make your skin get more better. And the other thing is, not many people know much about skin conditions. They just believe in myths, and whatever someone else tells, you just believe that. So that's not it. There's somewhere around 3,500 conditions which affect only skin. Leave about nail, only skin. So apart from only skin, you also consider nail. Nail again has multiple diseases which can be right from the birth till the death. The drugs that you take, it can impair your nails. So everything is it is a chain of reaction that happens. Okay, so then again your hair loss can be also due to multiple reasons. So depending on that, we have different types of treatment. Maybe it is cosmetic or it is medicinal. So again, cosmetic, it gets divided. Initially, again 10 years ago, if you take it, dermatology was just a end branch. That is, there's no further specialization after that particular degree. Okay, but now dermatology is expanding. You have clinical dermatology, dermatopathology, wherein the section of the skin that we send for studying to a pathologist. There again you have dermatopathologist who's expert in skin pathology. Okay. And then cosmetic dermatology, many of you would know, and many of you would be following on Instagram, Facebook, everything. So they come up telling that we make you have a glassy looking skin, you have this nice eyebrow, nice jawline. These are something related to cosmetic procedures like Botox, fillers, threads, HIFU. So such things come under cosmetic dermatology. And then there's a new branch that has been coming up, which is called psychodermatology. So if you're looking good, you feel confident. If there's something that is affecting your appearance, external appearance, you get affected to a certain extent mentally as well. So effect of skin disease on mental health and effect of mental health on skin. Because how exactly is, if you have a habit of washing your hands repeatedly, and if you stop doing it, you might have that compulsion to wash it again. We call it as OCD. So this is something again which is related to your thought processing. So this becomes a psychodermatology part. Okay, so this is about dermatology. And apart from that, we are the ones who deal with sexual medicine, be it HIV or any cases like leprosy. These are cases which were there once like long time ago in India, but right now the cases are reducing, but still there are cases. The only person who treats or who is capable of managing leprosy, which we call Kushta Roga, okay, or Kushta. So this is only a person with DVL degree can do. And if you want to check for the credentials of a dermatologist or a cosmetologist or a person who is treating all these conditions that I mentioned, you will have to look for MD in DVL or DND in DVL. So these are the only recognized degrees in India which will have any future. Okay. And again, after that, if you like some surgical procedures on the skin, you have to do a subspecialization or a fellowship, wherein you go for dermatosurgery procedures, that is called dermatosurgery fellowship, hair transplant fellowship, and then other procedures like fillers, Botox, you have to go for aesthetic fellowships. So different fellowships are available. So all of this is first MBBS, then you go to MD. If you're taking MD, it is for 3 years, wherein you have to submit a thesis and then get into your degree, get your degree certificate. Initially, there was something called as Diploma in DVL. Right now, that has been obsolete since the government of India or the MCI or NMC has been changed that diploma to MD seats. That is why you have increased number of MD dermatology seats now. So the chances that you might get in, even if your rank is little on the higher side, you still have chances because of that. And the other degree is DNB. So for DNB, you again have to clear an exam after your MBBS, and you have to work for certain period according to the regulations of NMC. So it has a particular attendance. It is very strict with the attendance. It is very strict with the number of procedures that you do, you see, number of cases that you record, all these. And after this, you can set up your own clinic. If you're a person who wants to work independently, you can set up your own clinic. No, I'm not comfortable with that, I would like to progress as an academician, then you can join a medical college. Again, medical college, you have government, private and central institutes. So if you're going for government college, you'll have to clear exams in that particular state of choice, because every state has a different regulation. So you get into your job. Again, private, based on your interview, based on your profile, your publications, you can opt for it. And if you're settling in that particular place for a private area, you can easily go for private medical college. And then again, central institutes, it is again based on an interview and a selection process which involves a written exam. Here again, your publications, what research activity you've done in a particular field, that would be counted very much. What is a major difference is, if you're opting for government and a private medical college, there is something called as SR-ship, that is senior resident. You'll be working for a year as an SR, that is senior resident. But in a central institutes, you'll have to work for 3 years as a senior resident. Only after 3 years of senior resident, you will be promoted as an assistant professor. So from there on, associate professor, professor. So that's the cadre or the hierarchy that we have. So in government and private, based on your availability, based on your academic achievements, you can go further. So there's a particular duration for it. So that's the basic difference that I would like you guys to know about progressing in the hierarchical level of the department. So apart from that, if you consider as a work-life balance, it is a very good subject. If you would like to remain in a peaceful way and you don't want too much of adrenaline rush, you're not very much comfortable seeing all those blood and havoc and chaos around, it's a very cool subject. People in dermatology department are also cool, and you don't have much of sleep disturbances in dermatology since there's no night duties. Coming to pay, it again depends on which sector you would like to choose, because again, if you're a person who's willing for a private setup, you need a huge amount of initial investment. The taxes that you have to pay is a little on the higher side compared to the other departments. And for example, if you take surgeries, other surgeries, they do claim insurance. That does not happen in dermatology. They have to spend it by their pocket only. Okay, so because of this, there might be people who might be able to afford the procedures that you're doing and pay you whatever you want. There might be people who might not be affordable also. So there's that difference regarding the procedural dermatology. But apart from that, again, more of a private practice, yes, good if you have an initial good investment, or as a professor, senior resident, you want to continue in this line, in a college line, then again it differs from cadre to cadre and from state to state. Because in certain states, for example in Tamil Nadu, you get around 1 lakh as a senior resident. So for an assistant professor, you get around 1.2 lakhs. And then professor, you might get as 2.25 lakhs. Okay, so that again depends on the institute and the state that you are going to choose. If a metropolitan city, private setup would be a better option. If it is some periphery or interior part, then you can go for a medical college. And if you're interested in academic, definitely go for a medical college associated part. Growth of dermatology department is again, see, I told you, initially like 10 years back or 5 years back, it was just an end branch. Right now, there's multiple specialities, be it dermatosurgery, cosmetic surgeries, pediatric surgeries. There's a lot of it. So the more you do research about it, the branch is going to expand. So there's a lot of potential. It depends on what your interest lies in. So it has a very good potential of diversification, if you ask me. Everything is fun. Like you see some skin lesions, you're always like into description. It looks rosy red, it looks pearly white. You get to use all those metaphorical terms, describe it as in like what you see, you can describe it, all fancy terms you have. So that is one part. And apart from that, you get to take care of your own skin. You don't have to ask for someone else's advice. You'll be the expert in it. So as a personal growth or it affects your confidence, right? So it is good for you. Don't have to go and stand in front of someone else. Study hard if you want derm, because that's the most sought or seeked subject. Because everyone from the other branches also, they're jealous or they envy about dermatologists. They're like, you're the only cool ones. You don't have night duties. You don't have to crib out or anything. You know everything. You guys are all well taken care of, well groomed. So you get a lot of that. If you enjoy that, do study well right now so that you can take up derm.